Well, hello and welcome. I'm Lisa Almo, Community Relations Representative here at the Lakeshore. Before we start today's presentation, I would like to share a little bit about our beautiful community. Many of you have visited our community previously, but for those of you that are less familiar, I would like to share with you that we are a premier retirement community that sits on the south shore of beautiful Lake Washington. We have 156 senior apartment homes offering a variety of floor plans, studio, 1-bedroom, and 2-bedroom options. Right now, we're moving new residents into our community and we're able to do full in-person community tours. So if you're interested in learning more about the Lakeshore, interested in a tour, or making a reservation for one of our beautiful apartment homes, please feel free to contact Alicia or myself or Lexi here at the Community Relations Office. I also want to be sure you're aware of an extraordinary partnership that the Lakeshore and the all 8 Era Living retirement communities have with the University of Washington. Our residents benefit from this partnership to deliver innovative programs designed with healthy living in mind. The partnerships lie with the School of Pharmacy, the School of Social Work, and the School of Nursing. For over 3 decades, Era Living has pioneered a powerful relationship with top-ranked University of Washington School of Nursing. The partnership allows us to our residents to benefit from evidence informed wellness and active aging programs. So before we get to the main event, I would like to tell you a little bit about our presenter, Karen Nelson. She has worked in the Medicare insurance industry since 2012 and has her life and disability insurance license in Washington, Oregon, and Idaho. Karen was an inaugural board member on the Humana Broker Advisory Council and is a member of the Senior Care Coalition, as well as multiple other senior advocacy groups. I've heard Karen make this presentation a few times, and she is so knowledgeable in this, and she'll tell you her history of how she became so knowledgeable about it, and how she wants to share some of the time that it's taken her to learn. She wants to share all her experience and knowledge with you. So Karen, take it away.
Thank you so much. I have to giggle when I'm talking about how I got started. I actually just ran across a Facebook memory from back in 2010. So right before I jumped into this, I sent a Facebook message out to all my friends and said, help, I need to know everything there is to know about Medicare and Medicare supplements, because I was kind of thrown into having to be that go-to person for a family member, of having to like help figure out what they were going to do for their health insurance. So I had to giggle about that the other day, where I look now and I have so many people who reach out to me as the one who knows anything and everything there is to know. I don't know everything and everything there is to know, but I have figured out where to go to get the answers if I don't know it. So I really like to, I'm going to share my screen here briefly. I like to pull the information that I do these presentations with from Medicare directly. So Medicare.gov, G-O-V, the government site, has the Medicare and You book right directly online. Most of you will receive that in the mail, but they do have it online for us. So I am going to share my screen here and see if I can't pull up hang on, give me 1 second. Can everybody see that?
I can't see it.
Can't see it. Let's see. Hang on, I think we have it. How's that?
Yes.
Yeah.
Good. Good deal. Okay. And kind of like what was stated before, if you have any questions, I do like to make my presentations a little more interactive. I find that keeps everybody a little bit more involved in it. I don't want anybody falling asleep while I'm talking about Medicare, like that's ever happened before. So I also have a tendency to kind of look, if you do have your camera on, I do have a tendency to kind of watch faces too, because sometimes I can notice that puzzled look and I might stop what I'm doing and try and make sure that you've got clarification if that's what you need. Okay, so Medicare and You 2022 is out. So let's thumb on down to the start of my favorite page. Okay, let's talk about what the parts of Medicare. A lot of you may have been on Medicare for a long time, but really don't know how it's all broken down. So Part A is hospital coverage, okay? Part B, we say medical insurance or your doctor's coverage. There's a lot more to both parts A and Part B. Part A is inpatient hospital care. It's also skilled nursing. Hospice is covered under Part A. Part B is, like I said, your doctors, outpatient, some home health, durable medical equipment is covered underneath Part B. Okay. Part A, Part B, and Part D. Part D for drugs. It's funny how many people don't recognize that Part D is actually for drugs. When you have Part A and B together, A, as long as you work 10 years or the equivalent of 40 quarters, you've already paid into the system for Part A. So you won't have a cost coming to you when you transition onto Medicare. But Part B does have a monthly premium. And no matter what insurance coverage that you get, you will always have to pay that Part B premium pending on income level. So majority of folks pay $150, right about $150 a month for their Part B. Some folks are going to pay a higher amount if their income is higher, and some folks might not even pay a monthly premium if their income level is small enough. The state might actually pay their Part B premium. But for a majority of people, A, again, you've already paid for. B has got that monthly cost right around $150. And then there's Part D. We're going to talk about Part D as far as whether or not you're going to get that Part D coverage separate in a standalone prescription drug plan, or if you're going to get your Part D coverage with a Medicare Advantage plan. We're going to talk about the differences. When you have Part A and Part B coverage, there's a rule that a lot of people have heard. It's the 80-20 rule, that Medicare is going to pay 80% and you can have insurance that'll pay that remaining 20%. But if you only have Part A and Part B all together, it really doesn't pay 80% equally at the end of the day. There's actually deductibles in both Part A and Part B that you have to meet first before it becomes that 80% coverage. And that's why it's a significant value to get some sort of an insurance plan so that you have those deductibles covered and then that remaining 20% of coverage. Okay. And when we talk about the breakdown, hopefully that'll take care of a little confusion there. So let's talk about the differences. Okay. So original Medicare versus Medicare Advantage, or what's also known as Part C. So original Medicare, if you look down this chart, it shows and says Part A, Part B, you can add a Part D, and you can also add a supplemental coverage. So original Medicare is having your Medicare Part A and Part B as your primary insurance. So if you were to go to the doctor's office, you're going to hand them your Medicare card, okay, with your Part A and Part B. And if you have that insurance plan, your Medicare supplement or a Medigap plan, your insurance plan, that would be your secondary to Medicare. So you would hand the doctor your Medicare card and your Medigap insurance card. When you have a Medicare supplement to go along with your Medicare, original Medicare, you may have 100% medical coverage, depending on the level of Medicare supplement or Medigap plan you have. We say Medicare supplement, secondary to Medicare, or Medigap plan, all meaning the same thing. It's that insurance plan that is your secondary to Medicare. Okay. And they're in a variety of different levels. So some people can have a plan that Medicare pays its 80%, and that Medigap plan is going to go ahead and pay all those deductibles and the remaining 20%. So you could have 100% coverage with any of your medical appointments. If you were in the hospital or you were going into skilled nursing or any of your standard doctor's appointments, okay? And then you get your Part D separate. So what's referred to as a standalone Part D. So when you have this strategy, when you're doing original Medicare, Medicare is the one who's going to say yes or no, whether or not you can have a service done. And the rule of thumb is if it's medically necessary, Medicare is going to cover that allotted amount for you. And then your supplement can come in and pay that the rest of the amount that Medicare doesn't pay for. If Medicare denies it, your Medicare supplement's going to deny it, because remember, it's your secondary to Medicare. But again, as long as it's medically necessary, Medicare is going to cover the service, and then your secondary is going to come in and pay that remaining amount. Now, we said Part B runs about $150 a month. Medicare supplements run on average right now about $200 to $220 a month, depending on which plan you have. So costs quite a bit right up front. But again, with 100% coverage, it's kind of nice that you can budget and say, this is what my medical is going to cost me from one month to another. And then you get your Part D separate. So you have another premium for your drug plan. And that can be anywhere from, say, just under $10 a month, all the way up to over $100 a month, depending on which plan it is that you have. Okay, does that make sense? Let me see if I see any nods of heads.
Mhm.
Any questions on that?
No.
We're good? Okay. So your Part D, we're going to talk about time frames of doing things, but your Part D, you want to shop for your Part D annually. This time frame that we have right now, October 15th through December 7th, that's the time that you want to shop your Part D, okay? Because your drugs can change every single year, and your formularies on all your drug plans can change every single year. So a formulary is basically how the insurance companies look at your medications. They're on a tier system. So we have tier 1 and tier 2 medications, which are your generics and preferred generics. And then we have tier 3, 4, and 5, which are your brands and your more expensive medications. So the lower the tier, the lower the cost on your medications. And that can change. So one year you might have a medication that's on a tier 2, and the next year on that same plan, it might be raised up to a tier 3 or tier 4. So it might not cost you a lot one year, but all of a sudden the next year, you could have a higher copayment on that medication. Well, the insurance companies are allowed to make changes. This is that time frame for us to look at what those changes are going to be for next year, and then plan according. If another plan would be more beneficial to you, that's when you want to make the change. And any change you make October 15th through December 7th will take effect for January 1st. Does that make sense?
Yes.
Okay, we're very fortunate in the state of Washington. We have an insurance commissioner who's very, very consumer friendly. We have a rule in Washington that is nowhere else in the states to the same degree that our rule is. And our rule says when it comes to a Medigap plan or a Medicare supplement, you could change that plan all year long if you would like to. Okay, our insurance commissioner recommends that you price shop your Medigap plan. So if you're familiar with an F plan, F as in Frank, or maybe a G plan as in Gopher, or N as in Nancy, those are 3 of the most popular Medigap plans. Well, an F plan is going to be the same no matter what your insurance carrier is. They're going to offer the same exact thing because it's a federally mandated plan. The difference is what you're going to pay for it in premium. And you'd be surprised, there are some companies that charge over $300 for the same exact thing another company is going to charge $200 for. So our insurance commissioner is, again, very consumer friendly, and he recommends that you shop those plans to make sure you're not spending more dollars than you really have to. Same exact coverage, just potentially at a lesser price. Those, like I said, in the state of Washington, you could change anytime you want to. But again, those prescription drug plans, the standalone prescription drug plans, your opportunity to make that change is October 15th through December 7th. Okay. If you ever run across anyone who says, oh, you need to be on this particular plan, you need to make sure that they have run your medications into Medicare system, because the only way to decipher the best plan for you is to put your medications into Medicare.gov's system. And the website and algorithm is going to spit out, for lack of a better word, what the best plan for you is. Okay. Some agents will only write a couple of different plans and they'll insist it's the best plan ever, but it might not be the best one for you. And again, the only way to do that is to actually go through and do the work. You could call Medicare. They will ask you for your medications. They could put it in the system just like a good agent could do. Or if you're very savvy on the computer, you could go to medicare.gov and do the same thing yourself. Okay. So when we have this strategy of original Medicare, we are going to pay a little bit more for that strategy because again, the premiums are going to be higher. But what am I going to get for that? Well, as we said, you could have 100% medical coverage. The other thing about original Medicare is you don't have any networks. So you don't have to ask permission. You don't have to call the hospital and say, do you take my plan? Because as provided they take original Medicare, all hospitals take original Medicare, but the doctor's office, it's not a matter of, do you take my Medicare supplement? It's, do you take original Medicare? And as long as they take Medicare, you get to go see that provider. Okay, your plan here in Washington is going to work the same in any other state as it does here in Washington. So if you were to do some traveling, maybe spend some time down in Arizona or going down and go see the grandkids in California and something happens to you, you get to use your plan the same there as you do here. Okay, Medicare is your primary, then you show them your Medigap plan as your secondary. Okay, so you have a lot of freedom with that. No one's on the phone asking permission. If the doctor says that you need to have an MRI, there's no one making a phone call to verify your coverage to make sure that you can have that MRI. You just get to go and have that MRI. So a lot of folks like that strategy because they can budget really well. They have a lot of flexibility. They're not having to ask any permission. And your coverage is really strong that way. But again, it comes at a cost. Okay, any questions on that strategy before I move on to Medicare Advantage? No? Okay. Either I bored everybody to pieces or I explained it well. I'm not sure.
Okay.
Go ahead.
I think it's the second.
Oh, you think it's this? Okay. I have done this talk a time or two. Okay, so let's talk about Medicare Advantage, or also known as Part C. I personally don't like that they call it Part C because what they try to tell us is A plus B plus D equals C. And where I come from, that's not really how it works, but that's what they call it. So Medicare Advantage, you will still have your Medicare Part A and B, okay? You're still going to have Medicare A and B. However, it is not going to be your primary, okay? With your Medicare Advantage plan, the individual insurance company is who's going to manage your Medicare, all right? So you're still paying that Medicare Part B premium, but say, for example, you might have a United Healthcare Medicare Advantage plan, or maybe a Humana, or maybe a Premera Medicare Advantage plan. That individual insurance company is going to be the one who is going to say whether or not you can have a service. Now, all of the Medicare Advantage plans all have to offer the standards with Medicare. They all have to abide by certain rules, but they can also offer extra benefits as well. So that's why you're going to see some differences between the different carriers, okay? But they all work pretty much the same. You have a network to your plan. You could have what's called an HMO, a health maintenance organization, where you have to stay inside your network. And if you go outside of your network, you have to pay the cost 100%. Or you could have a PPO, which is a preferred provider organization, where you're going to have one cost that's smaller inside your network and a higher cost if you go outside of your network. But the insurance company is still going to help pay a portion of anything that happens if you are outside of your network. Okay. And for 2021, we didn't have a lot of options, but for 2022, we're actually getting some really good options for PPOs for this coming year. Plans change every single year. We're going to talk about that. So when you have a Medicare Advantage plan, again, you're going to have networks, and typically, not all plans, but typically you're going to have to get permission from your primary if you need to go see a specialist. So you're going to have to get referrals. Not every plan has to have referrals, but a lot of them do. So these are more plans that are made, again, that you have to have some permission, and there's a reason behind that. They want to help make sure that your specialist and your primary doctor are talking to each other so they know what it is that you've got going on. Okay. If you are having to be seen, by a specialist, your primary might want to know what's really happening with you so that they can keep up on those cardiology appointments and have those conversations and dialogue between the doctors. These plans also, if you were to have an MRI or any other services, these are the type of plans that somebody is going to be on the phone and they're going to be asking just to make sure that that procedure is going to be approved. Okay. I have only known all of my years of working in this industry. I only know of one person who's ever had any service denied through their Medicare Advantage plan. And it was an extremely out of the box scenario surgery that she went to about 30 doctors before she found one that said, oh, I'll give that a shot for you. And her plan denied it. But I've never had anyone else with any standard procedures ever have a denial whatsoever. So there's a misnomer that if I have cancer or maybe I have COVID, that they're going to deny me. They're not going to deny you the service. It might take a day or two to get the approval, but the service is not going to be denied. Okay. So on these plans, remember we said A plus B plus D equals C. So on most of the Medicare Advantage plans, you actually have a Part D included. Medicare Advantage plans are lesser in cost upfront, sometimes $0. Sometimes a smaller premium, maybe $30, $40, or $50. But even at the $0 monthly cost plans, you can still have your Part D included. So you don't have an extra premium on top of you. And then, like we said, these plans all have to they have to go along with Medicare's guidelines as to what it is that they offer, but because they are private insurance companies, they can offer extra benefits for you. So this is that time of year we all see all those commercials. And as I like to say, Humana says, come to us, we're going to offer you this. And United Healthcare says, no, come to us, we're going to offer you all of this, because they all want your business. So they can offer some really great extra benefits that you would not get if you had original Medicare. And some of those benefits could be extra dental. They could be extra vision benefits, maybe some transportation, over-the-counter catalogs, gym memberships, lots of really great things for folks, again, that you wouldn't get on original Medicare, but they are offered with Medicare Advantage plans. Medicare Advantage plans are wellness plans. The object is to get you in, to check to make sure everything is going good. They want to try and catch anything before it becomes an issue. So if these plans are doing their jobs right, they actually are saving Medicare money, because rather than having to pay for this emergency surgery or what have you, or, oh my gosh, they're trying to catch it beforehand and maybe, go down that path to where they're not having to spend out all of the dollars for major procedures for you. It's really interesting the way some of these plans work, that they can catch, cancer at an early time frame. So Medicare Advantage, again, sometimes those premiums can be $0 up front. And I like to just say they're like a pay as you go. So you could have a majority of these plans, not all of them, but majority of these plans have a $0 copay when you see your primary. And the reason for that is they want to encourage you to go see the doctor. Remember, these are wellness plans. So let's get you in, let's do those preventative services, right? Because we want to catch it early. And then you're going to have a bit of a higher copay when you go see a specialist. And if you do have that MRI, you're going to have some costs that you'll have to pay toward that service. That's just how these plans work. But with that very low or no premium upfront, it works out really well in the end. If you're never using the plan, all you're doing is using the extra benefits. It's kind of nice for all the things that you're going to get when you've got a $0 plan initially. Okay. Now, some of the things that I like when I'm working with somebody and I am trying to help them determine whether or not they want to do a Medicare Advantage plan and maybe choose between all of them, because every county is different and these plans are all county based. We have close to 40 of them here in King County. If you go out to Kittitas, they have 4. They have fewer options. Snohomish has a lot. But again, they're county-based plans. So you got to look in the county that you live in, and there's certain factors to look at. You don't just like the commercial and go ahead and choose that particular plan. First of all, you have to make sure that your doctor takes that plan. That's number one. When I'm working with somebody, I always say, okay, what plans does your doctor accept? And what do your medications look like on this plan? How much are your medications going to be? They could be very significantly different between an Aetna plan, say, or a Humana plan or a United Healthcare plan. All formularies are not created equal. So some plans are going to cost more on the medication side than others. So then we look at copays and say, okay, well, what are these copays like? We want to make sure that if you get on a plan, you're not going to have high copays. And really, what's really, really important is the network. So there's a lot of plans that are offered and available, but who's going to take that plan? And even if your primary physician takes that plan, how many other hospitals are in that plan? That's really important, because if something is to happen and you need to go see a specialist, you need to make sure that there's a lot of specialists for you to choose from if you need to. So on these plans, the other thing are those extra benefits. And like I said, there's some dental, there's vision benefits, there's transportation. Some of these plans have an over-the-counter catalog. Basically, that's an opportunity for you to buy a variety of different things, like maybe Q-tips or Band-Aids or alcohol or cough drops. The plan is giving you dollars towards things that you might purchase at the drugstore. So that's kind of a nice benefit for folks. Any questions on that, on Medicare Advantage plans? We're good? Okay. All right. Now let's talk about when we can make changes to Medicare Advantage plans. As we said, Medicare supplements, you can change in the state of Washington anytime you want to. Okay. Your prescription drug plans, October 15th through December 7th. Medicare Advantage plans are a little bit unique. You can change your Medicare Advantage plan October 15th through December 7th. And if you make a change to that, it's going to take effect for January 1, just like your drug plan. But Medicare Advantage plan has another opportunity to change. And a lot of people aren't aware that Medicare came out with a rule a couple years ago. You can change your Medicare Advantage plan in the month of January, the month of February, or the month of March. And if you make the change in January, it'll take effect February 1. In February, it would be March 1. In March, it would be April 1. So you actually have 2 time frames in order to change your plan. And that's a really huge benefit for folks. During the annual enrollment period, this time frame now, the October 15th through December 7th, you can change your plan as many times as you want to. You can be on original Medicare and decide that, oh, I think I want to try a Medicare Advantage plan. Or you can change your mind and say, well, I don't think I want to have this carrier with Medicare Advantage. I want to try this other carrier with Medicare Advantage. Oh, no, you know what? I think I want to stick with original Medicare. You can go back and get a Part D in place. But the very last plan that Medicare sees in the system, December 7th at midnight, is the plan you're going to have for January 1. The open enrollment period, which is January, February, or March, for Medicare Advantage plans, you can make a one-time change. So that's really important. You can change your plan as many times as you want to during the annual enrollment period, but open enrollment is one-time change. And that's only for Medicare Advantage, not for Part D. Okay. Medicare Advantage rule says I can change from one carrier to another. So if I was on an Aetna plan and I've decided I want to have a Premera plan, you could do that. Or if you decide that you want from the Medicare Advantage plan to move over to original Medicare, you have that opportunity as well. And I've had a few people that have used that enrollment timeframe. For some folks, they've had a doctor change, or maybe they've had a diagnosis change and they've decided that they want to have some stronger coverage. Or I have had it happen where I've had a few clients that had a hospital stay during the AEP and weren't available to make a plan change, and they could do it during those first three months of the year. We also have what's called SEP, a special election period. Okay, special election periods are kind of one of my favorite things. I always tell all my clients, if something's happened to you, if you're having a significant change and you think that you might need to change your insurance, call me. I can't always guarantee I can find a special election period for you, but I will do my best to see if I can't trigger something that will allow me to make a plan change for you. A good example of time frame to do that is if you have a long hospital stay and you go into skilled nursing, you have a 2-month time frame to change your plan. Why would you want to do that? Well, it depends on what it is that you just had happen, and it also depends on your medications. So maybe you had a Part D that had, it was very basic. You weren't on any medications at all. So you were on a very low end Part D. And all of a sudden now you've had this diagnosis and your medications have changed and you need to have a stronger Part D. You have an opportunity in the middle of the year to make that change. Okay. Moving is also a special election period. If you're moving from not zip codes, but say you're moving from one county to another, if the plan that you're on is not offered in the county that you're on, you have a special election period to make that change. Of course, if you're moving from one state to another, you have that opportunity as well. So there's a variety of different special election periods. And like I said, that's kind of one of my favorite things is there any way I read all my rules and try to figure out, is there any way I can change that plan for somebody? And I'm usually pretty fortunate. Most of the time I can find one. On occasion, I have to tell somebody they're just going to have to wait until the next enrollment period. Okay, are there any questions to that? That's a lot of information in a very short period of time. I see a few people that were taking notes. Okay, why would you choose one versus another as far as your strategy for Medicare plans? A lot of folks will choose that Medicare, the original Medicare, if they want to budget, or if, like I mentioned before, if they want to have a lot of freedom or they're medically needy. It's a lot easier if you're going in and out of the doctor's office a lot, or you have a diagnosis that you might be spending more time in the hospital or having lots of procedures done. It's a little bit easier to navigate original Medicare. And a lot of folks really like Medicare Advantage because of that low cost and those extra benefits. Unfortunately, Medicare just doesn't see dental as an important benefit, and yet Medicare Advantage does. So it is kind of nice to have those low cost and lots of extra benefits. Okay. So again, I've really given you a lot of information in a short period of time. I can talk Medicare for forever, but basically that's given you a really good 101 on Medicare. So I really do encourage, if you have any questions, feel free to ask. Mary, are you thinking?
Now, I think you clarified the differences between general Medicare.
Say that again.
Medicare. I'm sorry?
I didn't hear you. You broke up a little bit.
No, I think you explained for me the difference between the initial Medicare and the Medicare Advantage plans.
Good, good.
Mhm.
So are you on Medicare?
Yes.
And you know which one you have?
Yes, I have the original AARP part.
And a separate Part D?
No, it's I have A and B, but AARP plan options cover
Okay.
the B. Mhm.
Okay. And then you have a separate Part D?
No, it's part of general Medicare, but I do have the supplement that
Okay.
covers the 20% difference in.
Okay. So
Mhm.
if you have original Medicare, you're handing your Medicare card, you're
Mhm.
handing your AARP card.
Right.
And then when you go to the pharmacy, you're handing a different card for your Part D. Is that correct?
Yes.
Okay, then you do have original Medicare. When I do these talks, what I really, really hope is at least if you, because a lot of people don't quite understand what they have. Somebody made a choice to put them on it, or maybe you did many years ago, but still really don't quite understand what it is that you have. So my goal is when I do these talks is hopefully everybody walks away and at least says, I know which plan I have. It's amazing to me how many folks, when I first got started in this industry, it was amazing to me how many folks did not know what their health care was, what they had for their Medicare plan, and had no idea how much they paid for it. And, you know, if we look at anything that we do, we go shopping, we always look at what the price is, right? We always want to make sure that we're getting a good deal and that we know what we're getting. And it's it was shocking to me to find out that a lot of folks don't really have any idea and they don't know how it works. And so I always say knowledge is power. And if nothing else, you should know what it is that you have for your coverage.
Karen, I have a couple of questions.
Sure.
Can you hear me? I'm on two computers,
Okay.
so I'm confused. Oh, shoot. Let me see. Maybe if I bring this down. Okay, my question is, for the copay on the MRI,
Uh-huh.
is that the $40 or whatever? Because you got to have a copay if you need something special, right?
So on a Medicare Advantage plan, you might have a copay for the MRI, or it might be co-insurance. It depends on the plan. Okay. So copay is a set amount. Co-insurance is a percentage. And so when you're going through and you're looking at the different plans, that's one of those things that you want to look at, because some plans will say, okay, and radiological, non or standard they'll either list it as a copay or they'll list it as a co-insurance. And again, it's just going to differ between carriers.
Okay.
Mm-hmm.
What about for therapy?
Same thing on Medicare Advantage. Medicare Advantage, you're going to have those copays. Okay. So one of the things that I always look at for folks is just to remind you, maybe you're going to have some copays with the Medicare Advantage, right? But if you're not paying a premium, those copays aren't too bad. But if you start really looking at really needing that plan and really using it heavily, then it's, you know, not a bad idea to look at original Medicare and, you know, maybe put those dollars toward a premium up front. So it's going to differ between people. You got to weigh it out. And sometimes, you know, sometimes when we weigh it out, you also have to remember with Medicare Advantage, you are getting a lot of those extra benefits. And if there are things that you're using, sometimes even paying those co-pays for some of those therapies and whatnot, it still works out to be a better bet for you because you've got that gym membership and you've got the extra dental and all the other things that go with it.
Okay, and then you mentioned about being in the hospital,
Mm-hmm.
that you can change. But when you're not feeling good, who do you call?
Do you have a good agent that you work with?
Not right now, no.
Okay. Well, you've got somebody, you got a resource right here. So if something happens, you know, my number, I've worked for several years, kind of partnered with Era Living. And so I think almost every community in Era Living has my information. So, you know, just make sure that you get that from Era Living or at the end of this call. And if something happens, feel free, you could always reach out to me. And like I said, if I can make it happen to get that change for you, absolutely, I'm going to do that. Sometimes I do have to say, I can't make that change right now. We're going to have to do it later, but I will try my darndest.
Okay, and then I just have one more.
Sure.
I've had bad experience with the doctors, as far as like, they feel like they're going to get paid for Medicare and they don't give me the best, what I feel I should get. You understand what I'm saying?
I do. And I think, do you have a good relationship with your doctor currently? It doesn't sound that.
Oh, no, I do. It's not her. It's the referral she gives me.
Oh, okay.
Not her. No, that woman.
You like her. Okay. Okay.
You don't play around.
Have you told her that?
Yeah, I did mention it to her about foot doctor. I went to the foot doctor. I don't know what you guys pay. I think I had to pay a copay. He didn't even touch me. I'm in pain still.
Okay.
So
I
I
would,
went to another doctor where I had to pay out of pocket. He took an x-ray, he gave me cream. And I'm like, wait a minute. Something's
mm,
right with this picture.
right. It could be coincidental though. It could have just been that one that you went to was really not a strong doctor.
Uh-huh.
The one that you went to that you had to pay out of pocket, does he take any Medicare plans?
Yeah. Oh, no. He, of course, I called him first. No,
Okay.
doesn't.
Okay. But it
And
could, honestly, it could have been coincidental.
well, I'm gonna go see another one. I think
Okay.
this month, and it'll be down at Valley. This one I went to Bellevue, and we just talked. I said, well,
Gotcha.
like, blah blah blah, and I'm like, I left out of there with still a lot of pain because my doctor recommended me go and see a specialist. I don't know. I guess she sent me to that one. She. I was disappointed.
Yeah, I would make sure you let your primary know that because she's the one that's going to give
No.
those referrals.
No,
Yeah,
she knows I'm a rebel. I
good,
let her know. No. She knows. But
good.
she gave
Okay.
me this is why I'm going to another foot doctor, but I'm hoping I don't get that same thing. I don't want to talk. Let's get a solution.
Absolutely. Absolutely. And if it happens that you've now had that same thing with the second one, that warrants a call to Medicare.
Okay.
That completely warrants a call to Medicare.
Okay.
Yep.
And then I'll stop, but there's another question I have when we go a little bit farther.
Okay.
Okay.
Anyone else? Cheryl, you might want to just jump in there again.
Okay, I've got another problem. I was getting my medication at Walgreens.
Uh-huh.
They don't even tell me they changed it. So every week I put my pills in the little, thing.
Your
And
Mediset?
I looked at it real good. I said, well, these pills are pink. They didn't even tell me they changed because they were white. So when I called them back up and I said, hey, I need the white pill. I don't see very good. I'm not going to be looking on these little pills. They wouldn't do it. So I have to go to another pharmacy, pay more out of pocket on my terrible budget. So I'm like,
yeah, that's not a Medicare issue. That's a pharmacy issue. Okay. So one thing that I like to tell all the folks I work with when it comes to your prescriptions, always do a comparison between your insurance plan and GoodRx. Okay, because sometimes you've got more savings and the pharmacist will go ahead and check that for you. Always ask the pharmacist.
yeah,
So,
but I don't have a copay. Everything I get is at
okay.
zero, so that's not a problem. But when they change it and they don't tell me, and then when I get it home, get confused, and then I'm like, wait a minute. So I go back to them and let them know. It's like, oh,
yeah, yeah, that's a pharmacy issue.
Yeah.
Gotcha.
What do you
do?
What do you do?
Well, that's talking to the pharmacy. So yeah, they're the ones that are going to do that. So next time you go to get it filled, make sure you specify so that you get the ones that you want to have.
I did, and they told me that's all they have. Like I said, I'm a rebel. I'm a speaker. I let them know what I want, and I'm like, that's it.
Yeah, I gotcha.
Yeah,
I gotcha.
Yeah.
Wish I could help on that one.
Yeah, I was very disappointed, but anyway. Okay.
Nobody else? Are we checking the chat box?
Anybody nothing in the chat box.
Nothing in the chat box. All right.
Oh. Karen, do you want to share right now? Do you want to share your telephone number?
Sure. It's 206-650-8073.
Do we make an appointment with you, or you just do this over the phone?
I can do lots of stuff over the phone. I know that the Lakeshore was talking about seeing if there were some folks that actually wanted me to come in. I can set some time up with folks and go there as well. Sometimes it's a quick question that somebody has, and like I said, I can do that quick over the phone or do a Zoom call. It's whatever's convenient.
Okay.
So we can, if you're interested in meeting with Karen, go ahead and give us a call here. The main number 206-772-1200. Ask for community relations. And we'll take down your name and number, and we'll give Karen a call. We'll get some idea of your schedule and match you up with her schedule. You guys can come here to the Lakeshore and meet, and she can review things with you and maybe save you some money or get you a better plan, or just kind of, confirm what you're doing is the best for you. So
Absolutely. I always like to be able to reassure folks if they're on the right plan. There are times it feels really good to just make sure somebody knows, don't ever let anyone change your plan.
yeah, exactly. Gosh, okay. Well, if we don't have any more questions, like I said, if you are, wanting to schedule an appointment to meet with Karen here at the Lakeshore, give us a call and we'll set something up for you. We will also be emailing everybody an evaluation form, and we would love to hear your feedback and on this presentation. It just helps us to know what we're doing right, where we can improve on these Zoom calls, although, we've done so many of them, unfortunately, over the last year and a half that we're getting okay with them, but we can always use some feedback on how we can improve. So if you could share your thoughts with us, we would greatly appreciate it. If you have any questions, if you think of anything, other questions for Karen, go ahead and email us. You can email us at the Lakeshore CR@eraliving.com, and we'll forward those to Karen. So I'm Lisa Alamo. It was a pleasure to be your host today and to see everybody. And I hope you learned some new things. Karen, another amazing presentation. Every time I hear you, I learn something new. And I really do appreciate it. My time hasn't come yet, but when it does come, I think I'll know pretty much a lot, but I'll still need to call you on it. So
Absolutely.
yeah, so great. So thank you. We hope you have a wonderful rest of your day. And thank you all for joining us. And we hope to see you soon here at the Lakeshore from other events. Keep your eyes open in your emails and your mail for our monthly highlights for events that are coming up. Our next one is Tuesday, October 19th at 2 o'clock. Gretchen Yanover is going to be doing a classical musical concert here. She plays an electric cello, and it's stunning. Her performance is stunning. So if you're interested in joining us, calls to RSVP. Due to COVID, space is limited. So please RSVP as soon as you can. We don't want you to miss out on this great event. So thank you again, everybody. Have a wonderful day.
Thank